Dr. Kessler, would you like to tell
Yeah.
me a little bit about this patient with metastatic breast cancer?
Okay, so she has Hep C also, and she had a brain clot. She had a stroke, and on the right side she had a portal. She's a new patient who just came to me to do the thermography, so I have some of her history, but not a whole bunch. She has stage 4 breast cancer and 411. She has back pain. She has tumors. She has she only allowed them to do chemo, one shot of chemo, and then she left the hospital, and they sent her home to die. And then she went back for a checkup, and they couldn't believe she was still alive. So.
Okay. So we're going to go through this, and then we're going to show you what is different about her thermogram than most of your patients.
Mm-hmm.
And so the first step is we look for the blocked spots from the neck down to the back, and including the breast. And here we see no blocked spots. The only blocked spots are in the head, which we see absolutely none. We wonder where is that reserve going if it's not expressing itself in blocked regulation. And instead, you see all of these very high values in the hyper range, where we see 72%, 100%, 100%, 72%. So hyperregulation is completely toxic. So what has taken over her body is impossible to be able to excrete through liver. You see the heat of the liver, but it's hyperregulating. It's turning this dark blue color. Normal regulation is the light blue that you only see in the cubital fossa, in the pelvis a little bit, here and there. And so whatever is happening has overwhelmed the body into an effect that where we see the head region is the chaotic one and the rest of the body is toxic. Some cancer patients can do this on their way out, where they have this split where you see even in the teeth there's all this differing kinds of regulations. You can tell that by all the different colors of yellows and blues and blacks. That's a chaotic look in the teeth, and the chances are that this originated from the teeth. However, it's a very difficult situation with, whether the thermography is going to tell you something that you didn't already know, and what are the steps that could be taken to maybe, add time for her, or to take a shot at creating a miracle, which a lot of us try to do. So going back to our protocol for looking at the thermogram, we see that there's some near blocked regulation. No, not really. There's just this toxic regulation, which is hyperregulation, in the neck down. And then we want to see what's the range in our step 2. We don't even see any block points in the breast, which is might have come up originally. Now, did she have surgery? Did she have what was done with the original breast cancer?
She had one dose of chemo. She did not have a mastectomy. She still has her breast, and they just took a tumor out.
And does the breast show that it still has tumors?
Yes.
And how does it show that? Are they coming above the surface, or
you could see it? You could see it. It's above the breast tissue. It's right on the breast tissue on the top. You could see it where it's coming out.
It's perforating the skin surface. So when you did your measurement of the points, you went around any lesion, right?
Correct.
Because if you measure a lesion besides it getting contaminated, it's not going to give you any kind of a reflection of the regulation system. Instead, it will look like you're just measuring dead or tissue, or the same as if you had a big scar there.
No, I went around it.
Yeah, it's always important to go around any lesion. And the span of seeing her energy in this way, where you can look at the range, the biggest range is from the upper abdomen at about 36.5 degrees going to the chest, the sternum point, or even in the maxillary sinus down to about 30.2. So that's about a 6-degree difference, which is getting to show that she's going to lack the reserves that are going to be capable to carry her through. It's a worse prognostic sign if you see a bigger span of the whole thermogram, and you can see that in the breast there's a tremendous span of 1, 2, 3, 4, 5, 6, 7 degrees. So you would wonder about her whole regulation being in this total toxic state. Then the next is to look at side differences, but in this case it's really not important except for maybe if you wanted to try to identify a focal infection. So in a case like this, we're not doing the normal thing we do with regulation thermography. We're seeing if there's any in towards trying to add some time or quality of life to the patient. And with someone like this, it's just, all you can do is help the detoxification process through liver remedies, kidney remedies, and that's the primary thing that could add quality of life, and then give her anti-inflammatories as well and help her with any pain she's having. So if we did look at the side difference, we do see a back problem here, because you see this back on the right sides, the 2 right sides is colder than the 2 left sides, so that's consistent with a vertebral abnormality. Then we go to the chest and we see this cardiac asymmetry with these 4 cardiac points, IC1 through IC4. In both cases, you see the left is much warmer than the right. Does she have any cardiac symptoms?
Nothing that she told me about.
Sometimes she may have it from chemo, but with only 1 chemo, it would not have caused big stress on the heart, but this looks like she has something with the electrophysiology of the heart when you see this asymmetry of the sides. The thyroid, as Dr. Livingston and many other oncologists have pointed out, the thyroid you see is normally above the baseline or at the baseline with the first measurements, but here you see both are way below the baseline. In cancer, especially breast cancer, there's almost always a thyroid hypo activity or metabolism with an iodine deficiency. In the head region, we do see a little bit of the ethmoids being asymmetrical. See, there's about a 1.2 degree difference, which indicates some kind of viral presence, which is kind of beside the point at this point. The mastoids are a little bit cold, meaning there's probably some vertebral metastases to the bone. We see then this big hyper-regulation in the CP points, which means that there's some implication to the brain. Does she have brain metastases?
Yes, she had a brain tumor.
So this is showing that the same creature is so toxic in the way that it's present in the internal circulation in the brain. And then you see this big asymmetry in the temples. This temple is warm and blocked, and the other temple is colder. This asymmetry in the temples indicates a pituitary imbalance or hormone problem. So we see some secondary complications due to this. And then with breasts, we look over here on the breast side temperatures to see whether those are asymmetric, and they're not. They are symmetric at 31.0 and 31.1. However, that's the least of our problems now with what's happening in the rest of the body to keep her alive. On the jaw, you do see a big asymmetry, and this can be due to the metastases to bone, or it can be due to the teeth having infections themselves. And as you look in the thermogram and the rest of the test, you could see maybe where this all could have started. So now we have a kind of an idea that this is a very, very toxic situation going into the head region, with chaos in the head, which is your main regulation of many neuroendocrine systems, neuroimmunological controls. And we want to look at the severes and the moderate. So here we have the severe toxicity. Here we have a moderate adrenal stress. Here we have a moderate endocrine dysfunction. We have the musculoskeletal stuff here with a little bit of a viral hint. We have the severe hypothyroid, or this could be hyper as well, because when the first 2 points of the thyroid are cold, like they are, way below the baseline, then you have to check for autoimmune thyroid. In the chest, we see that there is this electrophysiological stress to the cardiac region. This is meaning that her mineral imbalance must be off, so she probably needs electrolytes. And then she has a possible stress to the cardiac region itself. The liver is warm, but it's regulating, but still when the liver is warm, that means the first values are way above the baseline. Then you may, in this case, and you do want to treat the toxicities by helping the drainage organs, which is liver, kidney, intestine, and lungs if possible. The food intolerance means very little at this phase, or the dysbiosis, of course she has that. She has the kidney toxicity, which needs to be addressed immediately. And then we're going to leave to the next section to look at the dental and breast. So I'm following the same protocols we're doing with everybody else, even though this is a special case. Here we see some of the lymph involvement. We see the overall dark blue color, which is the color of toxicity. And in the teeth, we don't see any speckled look, which shows evidence of a possible abscess or a deeper infection. We do see these last 3 teeth, which we want to look and see one of them as a breast tooth, number 15, or number 27 in the European or Canadian ways. So we are going to be interested in this region that's dotted to see. Do you happen to know what breast it started in?
I'm going to say the left side.
So it's impossible to say, but you know, it's just this is ringing out as being a possibility. And these arrows are showing you that this left jaw is warmer than the right, which is just showing you either TMJ or neck problem is evident. In the breast section, we only see 2 criteria because this is a total overwhelm of toxicity covering over any kind of a blocked regulation that we would see in a normal patient. So when you have these very advanced cases, you are going outside of the normal range of most illnesses, and you have to put together any little hint that you can get from the thermogram to help. And the main hint that you're getting from this is to assist the drainage organs and try to facilitate her metabolism without stimulating the cancer. Then you see the severes and the moderates. She's exhausted. She's very toxic. She's got huge hormone imbalances. I'm sure the negative estrogens have just completely taken over. She has the structural implication in the TMJ and neck from the possible metastases. Here again is the thyroid and the head emphasis. And then we have the cardiac stress, and then some things in the gut, and then the kidney toxicity. So as we go back now to the front page after we've kind of surveyed, we do see that we would want to give her probably iodine, which is something that's being used a lot in cancer cases. We do want to detox, but you have to make sure that you do it gently in a case like this, because if you do something like infrared saunas and strong detoxifications, she will not be able to withstand the stress of that to the body. She should have a cardiac check. The endocrine, you just want to use DIM and other bad estrogen blockers, and you can help with the dysbiosis, but that's really what there is to do left in this case. But it's this is kind of an out of category of our normal thermograms in everyday practice. Somebody has either not really pushed her to do more, or she's made some bad choices. And, you know, it's sad.
I agree.